Dr. Alakija, thanks very much for making the time to join us today. Let's go into the issue of Viv Healthcare. They've now issued a voluntary license, and it will take years for generics to still be produced. And the company has said that it will also, in the meantime, make available their branded injection to 90 countries at a cheaper price, but they haven't told us at which price. And if we go by the history of pharmaceutical companies, we know they're not transparent about money. What now?
Also, whilst we welcome the fact that they have caved into pressure, because really that's what it is, it's a caving into pressure, which reminds us why what we do and what you, the media, do to help us put pressure on these inequities and the health injustice in this world is so important. So they've caved. We welcome the fact that they've caved to pressure, but it's all still very blurry. As you've said, they've said they will provide it at a price, but what is the price? How affordable is that price? They have given a list of 90 countries that they will make the patent available to through MPP. So, I mean, it's a step in the right direction, but the basic intrinsic issues around the inequities and the fact that we have to almost beg, scream, shout for the very basics of rights to basic healthcare and life that others in high-income countries enjoy, we still need to continue to interrogate.
As you've mentioned now, this announcement only came after a huge amount of public pressure. It didn't just happen. There needed to be a lot of activism around it. And it's by no means the first drug that was tested on people in Africa that this has happened with. So do you think African governments can do more to negotiate with pharmaceutical companies?
I absolutely do. And I think African governments, it's not just about negotiating with pharmaceutical companies. I think, and I've called for this before, I called for this when the high income countries in the UK and others shut out Africa, South Africa and others, when Omicron wave first started, that African governments themselves need to wake up. African governments need to understand that our lives are at stake. And it is not just about negotiating with pharmaceutical companies, but it is about using and utilizing our geopolitical power in such a way that we become reckoned with, because at the moment the world is not reckoning with us because we're not fully utilizing who we are. We're not standing up. I would say sort of almost colloquially that our leaders need to recognize who they are, how important they are in terms of the wider global polity of nations, as it were. Right now we have Russia on the doorstep of Africa. We have Macron, President Macron of France, also visiting African countries, because there's this competition for who Africa is going to lean towards. It needn't be a competition. Our leaders also need to themselves stand up and be able to be the statesmen that sadly most of them are. I don't see many women. We have one in Africa, the statesmen, and let us speak prophetically into the distance, the stateswomen that they should be. So it is not just about pharma. It is about our wider health security. It is about our wider peace and security. It is about our wider food security. We have a problem of leadership, which is why the world is taking us as people for granted and is making it look like a life in Abuja is worth less than a life in Alberta, Canada. That should not be the case. A life in Cape Town should be worth the same as a life in Connecticut. But it is at the moment what the world is telling us with these drugs and these withholding of access to medicines and medical countermeasures is that our lives are not worth the same. And that is not just on pharma, that is on us. It is on our leadership. So activism will go so far, but what we need is political change.
If an African president came to you today and say, what should I tell the pharmaceutical companies? How should I do this to stand up against them? What advice would you give them?
That's a very good question. I don't think it is one thing that we can tell. I think, it is not so much what I say, it is what I do. And that is what I'm saying about our leadership. I think our leadership need to begin to put their foot down in those geopolitical spaces, be it at the UN or at the various assemblies that they attend, that they often go to. They have a speech and they make a speech, but they need to start making demands. They need to start saying that, when, for instance, let me use the example of what happened with Aspen Pharmaceutical in South Africa, when the world is refusing to buy medicines and drugs from Aspen's pharmaceutical. Our countries must sit down and say that our presidents, if one came to me, I would say, you know, Mr. President, I would advise that you tell these people who are refusing to purchase and refusing to support our own homegrown pharmaceutical industries that until they do that, we no longer want what you are giving to us. We will go looking ourselves. We will find our own procurement mechanisms, because if it is not meant to benefit us as a people, if you want to keep this dependency, this charity model, the charity model no longer works. It needs to be a partnership model. We need global multilateral partnerships, not global charities that are basically controlled by men largely from the high-income countries of the world who tell us who must live and who must die. It is wrong.
Now, when it comes to inequality in the health world, it goes beyond the prices of drugs, right? So just last week at the AIDS conference in Canada, many people from Africa couldn't attend because they could either not get a visa or they simply couldn't afford to travel there. How does that impact on who's got to have a say in how to tackle HIV?
Well, Mia, that is a pet peeve of mine, because I myself have been unable to attend that conference because of the prohibitive cost. I have friends who were denied boarding, having paid over $20,000 to get visas, to buy tickets to go so that their voice could be heard. Winnie Binyima herself, the executive director of UNAIDS, who's from Uganda, an African woman, was almost denied boarding to attend a conference, which basically is her core business in Canada, because she is a Black woman. Institutional racism is the problem. One day we will have a conversation about institutional racism, and one day we will have the conversation about why we are still in a pandemic, because institutional racism meant that when a director general of the World Health Organization, who was a man from Ethiopia named Tedros, declared that the world had a problem, presidents of high-income countries refused to believe him. They denigrated him, they mocked him, and therefore the rest of the world did not take this seriously. What would have happened if Tedros from Ethiopia, Northern Ethiopia, had been Ted or from Colorado? What would the world have done? Would they have taken COVID more seriously? Would they have not done the blatant disrespect that they did to him, which meant that countries were behind? They disrespected him. They disrespected his voice, as they are disrespecting us today, as they are disrespecting our voice. That is why they're not allowing us in the door. So what I am calling for is for people to stop hosting these conferences in these places. You cannot talk about us behind our backs. The majority of the burden of the disease is in our countries, and largely because you refuse to provide us access to drugs, refuse to provide us access to testing for HIV, as for HIV, so it is for COVID. So essentially, there is no point in having these conversations behind closed doors with people from high-income countries who will again decide for us what we must do in our own countries, when they have no idea what it is to walk in our shoes. They have no idea what it is to stand in our shadow, to stand in our own sun, or to stand in our own rain. So it is time that the world, and again, our leadership, start to say, no, we are not having the conference for AIDS in Canada, or the climate change conference in Glasgow, which no doubt will have the same problems. But we will have these conferences in the global south, where we welcome people with open arms, where we treat people with dignity, we treat people with respect, and we tell them, come, not so we can make decisions for you, but we tell them, come so that we can talk together, we can make decisions together, because it is only when this world acts together as one that we're going to have equity and justice and true health security for the entire planet.
This institutional racism that you're referring, of course, goes even a step further to the research world, that when researchers from the global north come to the global south and use the equal help of global south researchers to do their research, when it comes to publication, the global north people are almost always the main authors, and the global south researchers get less recognition. How do we change that?
We have to shake up this world. I mean, you are stirring me up, Mia, and I need to not be so upset. It's not about being upset, because then they will call one an angry Black woman. It is about recognizing that we cannot leave this world to our children. I'm the mother of a girl child who I want to not have to fight the fights that I have fought as a woman, that I don't want to have to walk into the spaces that I walk to and have to almost cower and keep my voice down just so that they will let me stay in the room, because they must not feel threatened by the power of Africa and the power of woman. So we're going into gender, we're going into institutional racism, capitalism, but it is a power of money. It is a power of the dollar, because the power is in their hands. Money is power. So it is those institutions that have power who will say to the likes of me, Yodi, come, let me take your ideas down. What do you think about this over a phone call? They will walk away. They have 10 research assistants. They will write everything that I've said down and they will publish it as their own. It happens even to me, even today. People are still doing that because I don't have the time, because I don't have the resources. So that's why I say that money is power. We are so busy dealing with leadership in Africa. We're dealing with power cuts. We're dealing with security issues. So we don't have the time and space to imaginate, to reimagine this world. But what we need is we need to reimagine the world of global health. We need to reimagine the world of global development. We need to look at what equity looks like. We need to have the conversation about institutional racism that says that because my voice might be slightly different from yours, your voice has more value because you're a man, or because you're Caucasian, or because you come from the global north. This is a conversation that I've said this before. In the late 1940s, when the Bretton Woods institutions were put together, they were put together to rebuild Europe. That is where we got the UN. That is where we got the world. All these Bretton Woods institutions were put together to rebuild Europe. That was their design. So inherently, the foundation of what we're working with is flawed because it was not meant to help us. So those systems were built for a certain geography. And what I'm saying is, whilst multilateralism is great and it is what we need as a world, we have to reimagine it. We have to redesign it. We have to be involved from the ground up. They cannot just use our voices. And the other thing that is happening at the moment is that they will pull the voices of those they know that will be quiescent, the house slaves, as they used to do in the South, in America of old, the ones that you have given a little bit of entry and you can keep them quiet. The fiery ones like me, they will say, no, 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 we must keep that one far away because she will tell us the truth. We must come together as a community of people from the global South. Africa must come together. Latin America must come together. India, South to South cooperation to show the world that we are more than half of this planet and we will not be treated like this. And this world cannot have equity and justice until we all are treated on the same playing field.
Dr. Alekija, I will vote for you as President of Africa. Thanks very much for your time and sharing all your insights today.